treatment success rate. So while we have not reached the 90%, we can see that we have moved from around 45% in 2014 to around 80% in 2021. Next slide. Next slide, please. For TB preventive treatment, this just highlights the big gap in terms of our target and accomplishment. Next slide. So in summary, in terms of screening, we need to continue to improve because there are still areas, such as GD areas, that remains low in terms of chest X-ray screening. For testing, it is increasing, but only 65% of our notifications are tested with rapid diagnostic tests. And while we are narrowing the gap in TB notifications, 70% of our DRTB cases are still missing. In terms of treatment, we have to address the loss to follow-up for both drug-resistant and drug-susceptible TB. And we need to strengthen our contact investigation to improve our TPT targets. Next slide. So I will not discuss this one by one, but these are the challenges that we have seen as we do our monitoring and program reviews for each of the cascade of care. Next slide. And these are the challenges that we try to address as we move into the new National Health Sector Plan or Philippine Strategic TB Elimination Plan 2025 to 2030, which is, next slide. Next slide, Bob. Aims to have a TB-free Philippines with zero TB deaths, and specifically to accelerate the reduction of TB mortality rate from 18 to 5 per 100,000, TB incidence rate from 643 to 300 per 100,000, and reduce catastrophic cost to 0%. Next slide. To achieve this goal, these are the service delivery objectives that we want to achieve in the 5 years: to screen 10 to 13% of our population with chest X-ray, test all of our presumptive TB, and detect 90% of our incident TB cases, successfully treat 90% of our notified TB cases, and provide TPT to at least 75% of our eligible household contacts. And for us to deliver the service delivery objectives, we need the following cross-cutting objectives. We have to be resilient. We have to have a good health-seeking, positive, healthy behavior from our patients, and we should have an enabling health system that supports TB elimination. Next slide. These are the numbers in terms of targets that we're looking into. Next slide, please. And the basis for our costing. These are the strategies that we are going to implement in the next 5 years to achieve the service delivery objectives that we have put into the plan. Next slide. And based on our computation, we would need a total of 121 billion pesos for the whole 6 years of the field step 2. Next slide. Major cost drivers of our strategic plan are our chest X-ray screening and our commodities such as the rapid diagnostic tests and the first line and second line drugs. Next slide, please. So our call is that for us to achieve ending TB, we need to invest in systems, innovations, and resources that drive TB elimination, collaborate across sectors to deliver integrated, people-centered care, and commit to the goals and targets of Field Step 2 and take action to end TB by 2030. Because we can only end TB if we work together. That's it. Thank you. Thank you, Dr. Charis. May proposed recommendations ba ang department sa Senate bill? Yes, for Senate Bill 952, we propose we the Disease Prevention and Control Bureau expresses strong support for the proposed measures to establish a comprehensive TB notification system, establishing a TB notification committee and registry across all levels of the health system. We also support the expansion of the TB benefit package under the Philippine Health Insurance Corporation and continuing to clarify the roles of other government sectors and agencies and strengthening the engagement of the private sector. The proposed amendments will help ensure the availability of high-quality, timely data needed to guide the development, implementation, and monitoring of evidence-based strategies for TB control. These measures are particularly urgent given the country's epidemiological context. In addition to its health impact, TB imposes a substantial economic burden on affected families, as mentioned. That's why expanding and enhancing the PhilHealth TB package together with clarifying the roles of the Department of Social Welfare and Development and local government units in delivering social protection benefits will be critical to achieving the goal of zero catastrophic costs. Furthermore, with at least 30% of the TB patients managed in the private sector, strengthening private sector engagement is essential to expanding service coverage, improving continuity of care, and closing referral gaps between public and private providers. The Bureau supports the inclusion of additional sections in the proposal, subject to several recommended refinements. So for Section 16, we recommend that national recognition be not limited to business organization, but also include other private sector entities such as non-government organizations and civil society organizations. For Section 18, we suggest to revise the term Service Delivery Network to Healthcare Provider Network for consistency and alignment with the Universal Healthcare Law. And we also propose adding a requirement for members, for the 4-piece members to undergo annual TB screening and when indicated, to complete TB preventive treatment in addition to the conditionality of completing the TB treatment. And then we also recommend replacing the term prophylactic treatment with TB preventive treatment to align with the current terminology. Finally, we would like to advise the penalty provisions undergo further review and consultation with relevant agencies to ensure consistency with existing laws and regulations. Yeah. Thank you. We will submit specific recommendations on both bills as well. Thank you po. Thank you so much for those, Dr. Charis. Napansin ko sa slides niyo may pagbanggit din sa children. So, kasama ba dito sa, TB yung primary complex? Yes po. Okay. And then, yung 121 billion for 6 years, that's just about 20 billion a year. Historically ba nag-request ang DOH for 20B for TB prevention and response para sa GAA or at least sa NEP? For DOH, we are, for 2025, we are at around 2.6 billion. And then we requested the NEP for 2026 increased to around 4.8 billion. So from 10% to only 20% of what DOH itself says we needs. Yes. Okay, so kailangan talagang makapag-source pa ang department. Salamat po, Dr. Charis. So could we hear from other resource persons, including CSOs and patient group representatives, yung inyong assessment sa current situation, yung view nyo sa government response at saka proposed amendments sa bill? Would anyone like to? Yes, Ms. Amara for Achieve.
Thank you, Madam Chair. And thank you to the DOH for that presentation. Among the critical issues that the communities are currently facing in terms of in terms of TB in the country is, I think one of them is mentioned earlier, our treatment for drug-resistant TB is donor-dependent. It is not covered under our PhilHealth, and yet this probably is one of the reasons why we rose from our position in the global TB burden from number 7 to now number 3. Second, the current policy framework for TB does not look at stigma and discrimination, but our communities have experienced more critical levels of stigma and discrimination when it comes to TB. For an organization like Achieve that has worked on HIV and AIDS for more than 2 decades, we are surprised to find that stigma on TB is even more prevalent and even more insidious in the way that it really prevents people from coming out and seeking test screening and treatment. We support the bills that are currently filed in the Senate, and specifically reiterate the need for the following. The reason that we are able to generate data from communities' experience is because of community-led monitoring. They report on stockouts of medicines and diagnostics. They report on experiences of stigma and discrimination, both at the community level as well as in facilities. These are the types of information that we need to make sure that services are appropriate and are relevant, and that they are accessible to the community. So similar to HIV and AIDS, we push for the institutionalization of community-led monitoring as source of strategic information for decision making. Secondly, again, similar to HIV and AIDS, the decreased donor funding in 2025 has dramatically affected the TB programming in the country, because more than HIV, TB is dependent on donor funding. As said by our colleague from the Department of Health, 2.6 billion for 2025 is very small compared to the need for TB. Drug-resistant TB and the introduction of new technologies for TB screening is introduced by donors. Without donor funding sustainability, it is virtually impossible for the Department of Health to fully finance the Phil Step 2. And I would second the question of our chair earlier to the Department of Budget to look into how the Department of Health and other relevant government agencies can more efficiently allocate resources to really have a chance for a multi-sectoral approach in combating TB. One key issue in financing for TB is that even the Global Fund to Fight AIDS, the grants that we receive from the Global Fund to Fight AIDS, TB, and malaria in the Philippines is currently being taxed by government. The Global Fund has refused to pay these taxes and has deducted this from the grants that we receive, which means lesser money going to community and interventions that would save lives. Our third recommendation, again similar to HIV, is to support community interventions through social contracting and sharing of resources between government, civil society, to promote patient-centered care and enhance stigma reduction efforts. We applaud the effort to now include sections, articles that in the bills that talk about human rights of people with TB, previously not recognized in the current law. And we also push for the recognition of the increasing number of community-led organizations of people who have survived TB, patient groups. I'm glad that one of them is in the room to speak in behalf of the community again. One area of concern that we have seen in terms of the barriers for TB service delivery is that it is not disaster resilient. Just last week, we were in one of our LGU partners in Cavite, and we were informed that every time they have rains, the health center is flooded. And we asked them, so does that mean nagsasara po kayo pag binabaha ang center? Ang sabi po nila, hindi po pwedeng magsara ang center. So lumulusong po kami sa baha. Umiinom lang po kami ng doxy para po hindi kami magkaroon ng leptospirosis. We cannot have health centers submerged in floods. and overrun during disasters because they are the first line of defense for the delivery of our healthcare services. We saw in the data of the Department of Health that during the COVID, the notification